Have you ever looked at an arterial blood gas result and thought, where do I even start? If that's happened to you, stay with me because today I will show you quick and easy tips to interpret arterial blood gases, ABGs, like a pro. By the end of this session, you will be able to recognize acid-base balances in less than 1 minute. Let's get started. What are arterial blood gases? Alright, first thing first, an arterial blood gas, ABG, measures how well the lungs and kidneys keep the body's acid-base balance. We usually look at 5 key values. pH, tell us if the blood is acidic or alkaline. PaCO2, reflects respiratory function. HCO3, the bicarbonate, reflects metabolic function. PaO2, the amount of oxygen in arterial blood. And finally, the SaO2, the oxygen saturation percentage. Imagine a seesaw. One side represents acid and the other base. The body constantly works to keep the balance between 7.35 and 7.45. Let's break ABG interpretation into 3 quick steps. Step 1. Look at the pH. If pH is less than 7.35, it's an acidosis. But if the pH is more than 7.45, it's an alkalosis. For example, pH 7.30, that's an acidosis. But if you have a pH 7.50, that's an alkalosis. Is it so far not? Perfect. Now let's move to the step 2. Look at the PaCO2, the respiratory side. If the CO2 is high, then 45 is a respiratory alkalosis. But if the CO2 is low, then 35 is a respiratory alkalosis. Think of the CO2 as bubbles of carbonic acid. More acid, more CO2. If your patient hypoventilates, CO2 builds up. That's a respiratory acidosis. If they hyperventilate, too much CO2 is lost. That's a respiratory alkalosis. Now, finally, the step 3. Look at the HCO3. That's the metabolic side. Low HCO3, less than 22, that's a metabolic acidosis. But if you have a CO3 higher than 26, that's a metabolic alkalosis. A quick memory tip is the mnemonic CO2 for lungs and HCO3 for kidneys. Now, let's put it all together with some quick examples. Example number 1. You have a pH equal to 7.28, a PaCO2 equal to 15, and HCO3 equal to 24. Step 1. The pH is low. It means acidosis. Step 2. The CO2 is high. The cause is respiratory. So finally, the diagnosis is respiratory acidosis. For example, a COPD or hypoventilation. These conditions trap CO2 inside the lungs. Example number 2. The pH is equal to 7.50, the PaCO2 is equal to 30, and HCO3 you have equal to 24. The pH is high, it means alkalosis, and the CO2 is low, it means respiratory cause. The diagnosis is respiratory alkalosis. For example, hyperventilation, anxiety, or pain, because the body is blowing off too much CO2. Example number 3. pH is 7.30, PaCO2 is equal to 38, and HCO3 is equal to 18. pH is low, it means acidosis, and HCO3 is also low. It equals to metabolic cause. The diagnosis is a metabolic acidosis, for example, diabetic ketoacidosis or renal failure. Example number 4. pH equal to 7.48, PaCO2 equal to 40, and HCO3 equal to 30. pH is high, it means alkalosis, and HCO3 is high, it means metabolic cause. The diagnosis is metabolic alkalosis, for example, vomiting or diuretic use. Think of a stomach losing acid like a leaking container. Sometimes the body tries to correct the imbalance. This is called compensation. Here's a quick trick to recognize it easily. If pH is still abnormal, partial compensation. If pH is back to normal, full compensation. For example, if you have a pH 7.36, a PaCO2 48, and HCO3 equal to 28, the pH is normal but slightly acid. Both CO2 and HCO3 are elevated, fully compensated respiratory acidosis. Think of the seesaw again. One side goes down, the other goes up to keep the balance. Let's test your speed. I will give you the values and you will think at the answer. First one, pH 7.25, CO2 55, and an HCO3 of 24. Which type of imbalance is? Exactly, respiratory acidosis. Let's move to the second example. pH is equal to 7.50, CO2 30, HCO3 24. Which type of imbalance is? Correctly, respiratory alkalosis. Third example, pH 7.32, CO2 40, HCO3 18. Which type of imbalance is? Exactly, metabolic acidosis. And a final example, you have a pH 7.47, CO2 43, and HCO3 of 30. Which type of imbalance is? Excellent, a metabolic alkalosis. Congrats! You now are a master of the basic foundations of ABG interpretation. So let's review. Start always with the pH. Check the CO2 for respiratory issues. Check the HCO3 for metabolic causes. And finally, think about compensation. Always remember, your acid base is seesaw, and you will never get lost again. If this session helped you, safely share it with your classmates and join to Enfermeras en USA, where we make complex medical topics simple, visual, and fun to learn. Don't forget to follow us on Instagram, YouTube, TikTok, and Facebook as Enfermeras en USA or Enclas con Enfermeras en USA. Thank you for joining, and remember, the more you practice ABGs, the faster your brain will balance the seesaw. See you in our next learning session.